So in conclusion, when we treat prostate cancer at an early localised stage, it's important to realise that there is no such thing as a treatment without any side effects. A lot of people say there's no free breakfast. So we need to be mindful of what the side effects could be. We clearly need to tailor the therapy to us as individuals to minimise the side effects we're not prepared to accept. We need to manage the side effects if they occur to us in a compassionate and caring and individualistic way. We need to have a good team around us, and that may include many, many people, including the urologist, radiation oncologist, dietitian, sexual health physician. We need to have good, supportive, positive friends. We don't want to have negative people around us during these times. And so surround yourself with positive people, and most of all, remain optimistic. There is a treatment, and you need to understand that whilst there is no free breakfast, you can certainly minimise the chance of any side effects and manage them all successfully. So focusing now on the lifestyle issues that you can use whilst on hormone therapy, or for that matter, on all levels, at all stages of prostate cancer. What are the things we can do for ourselves to improve our well-being, our immunity, and our quality of life during the whole prostate cancer experience? Let's go through them. Number one, we need to exercise. Number two, we need to maintain a good healthy diet. What does that mean? It means a good Mediterranean diet, lots of vegetables, not too much fat, and not too many calories. Minimise your stress. How do we do that? Avoid the situations that cause it and start focusing in on what's important to you and do those type of things. This could be a life-altering experience, and you can use it to your own advantage. The mind and spirit. We have a lot of evidence now that different forms of meditation, or what we call mindfulness, can make us cope with stressful situations much better, cope with pain much better, cope with depression much better. And it's a very simple thing to do, but it requires a good meditation expert to be able to allow you to achieve this successfully. This is not for everybody, but it's certainly something you could consider, particularly with the recent information that depression can actually worsen your T-cell immunity, which in fact can have a negative effect on your cancer. What supplements can we use? Everybody always asks this question first because it's the easiest thing to do, but it's actually the least important of all the factors. So in addition to exercise, diet, stress reduction, mindfulness, it's important to consider these as well. So what are they? We need to get our vitamin D levels to optimal levels. Many Australians are now vitamin D deficient. There's evidence that lycopenes, which is the red part of tomatoes, particularly in a cooked state, can help. There's evidence that selenium in the yeast form may have some benefit, but there is some controversy that surrounds that, and excessive selenium is not good, so less than 100 micrograms per day. There's also evidence that soy products may be useful. There's evidence that fish oil and omega-3 type of diets may be useful. So all these things may help, in addition to some of the less proven things such as pomegranate, curcumin, and I could probably list 1,000 other ones that people talk about. But the ones I've mentioned have at least some evidence, and in fact you can refer to one of the textbooks which are coming out on this, which I've written the chapter on recently in integrative medicine. If you want to know more about this very interesting area, you can go to the recently published book by Karen Phelps and Mark Hassad on our website, where I wrote the section on prostate cancer integrative care, and a lot of this is referenced.